I'm a resident of Mandeville and the father of 2 children in the Mandeville public school system. I will be your moderator for this evening's forum. Before introducing our panel, I would like to give you some information on pesticides and their effects on children. The reason for this meeting is to discuss the safety of and educate us, the parents and guardians of our most prized possessions, our children. The children are the future of the world, and we have an obligation as parents and guardians to make it as safe a place to live and learn in as possible. We need to be ever cautious of the environment and what we do as individuals or groups that affect the environment that can harm our children. I would like to quote from an article, Children and Toxic Chemicals, by Dr. Beverly Pagan, research biochemist at Children's Hospital Medical Center, Oakland, California. Why are children more sensitive to toxic chemicals? Most parents have had the experience of watching in amazement as a small child consumes a meal that is almost equivalent in size to an adult's meal. Children eat more food, breathe more air, and drink more water per pound of body weight than an adult. Because a child expends more energy and because a child is growing, his or her requirements for food and oxygen are greater. Thus, the dose of toxics per pound of body weight is higher. This is one reason that children are more susceptible to environmental toxins found in food, air, or water than adults. Children are more susceptible to environmental toxins than adults because children are growing. More is required than just maintaining the status quo. Many toxins, particularly those that cause cancer, damage rapidly dividing cells more than they damage cells that are in a resting state. Children are also more susceptible to toxic chemicals than adults because some organ systems, particularly in the very young child, are immature. The child's immune system, the system that fights off disease, is immature for the first 2 years of life. A child exposed to a toxin affecting the immune system will have more ear infections, more colds, more pneumonia, and more flu. A child is more susceptible to environmental toxins because of lifestyle. A child is more likely to have intimate contact with contaminants in soil than an adult. The child plays in mud, splashes in a nearby creek, and inadvertently ingests a little dirt. Many chemicals, especially organic solvents and chlorinated pesticides that concentrate in the fat, are absorbed through the skin. Neurotoxins are chemicals that affect the brain and the nervous system. They cause symptoms such as severe headaches, dizziness, memory loss, clumsiness, vision and hearing problems, loss of balance and tingling or numbness in the hands and feet. In children, neurotoxins can cause learning problems at school, hyperactive behavior, and seizures. If exposure to neurotoxins continues long enough, permanent brain damage can result. Currently, government does not require testing for the specific neurotoxic effects of pesticides. Our aim tonight is to focus on the safe, effective, and less expensive alternative to the use of toxic pesticides and herbicides in our schools. This can be accomplished through an integrated pest management program, or IPM. Integrated pest management is the coordinated use of pest and environmental information with available pest control methods to prevent unacceptable levels of pest damage by the most economical means and with the least possible hazard to people, property, and the environment. The goal of the IPM approach is to manage pests and the environment so as to balance costs, benefits, human health, and environmental quality. IPM systems utilize a high quantity and quality of technical information on the pest and its interaction with the environment. Because IPM programs apply a holistic approach to pest management decision-making, they take advantage of all pest management options, including but not limited to the judicious use of pesticides. Despite its technical sounding name, IPM principally relies on a combination of age-old common sense practices. To understand IPM, you need to understand pest behavior. Pests require air, moisture, food, warmth, and shelter to survive. They seek habitats which provide these basic needs. Therefore, to prevent or control pest populations, you can create inhospitable environments by removing some of the basic elements pests need to survive, or simply block their access into the building. When these methods fail, pests may be eliminated by mechanical, such as traps, or chemical methods. Before the correct action can be taken, it is essential that you notice evidence of the pests and the habitat. IPM consists of first, inspecting and monitoring the site; second, deciding on your level of tolerance; third, applying IPM strategies; and fourth, evaluating the program's progress. This is a method that is endorsed by many groups, including the National PTA, the National Education Association, the American Cancer Society, the American Society of Pediatrics, the Texas State Legislature, all schools, and numerous school districts across the country.